So these investigators were looking at a common molecular signal pathway in the heart cells that basically start to trigger the maladaptive responses. And you know, when proteins and enzymes and stress hormones are released over time, tissues, specifically the heart too, really don't respond well, and they start to have negative architectural changes. So these researchers were starting to find kind of a common dual pathway where certain phosphodiesterase enzyme subtypes can contribute, when not properly functioning well, to a maladaptive protein that can no longer cardioprotect the heart. So if there are now ways to perhaps inhibit these sorts of enzymatic processes, we might now have a more suitable target to proceed ahead. As far as I know, it's in development. I mean, it's a promising avenue, but we've been hearing different avenues of treatment for a while. Some have fallen out of favor, some are starting up in different phases of trial. But it's a very forward-looking process. And I think, you know, it's a very complicated discussion to have, but when you see that there are a number of different pathways at play, you know, we have to decide and make sure that by inhibiting one pathway, we're not stimulating another process, like an oncology problem, you know? So it's going to be, we need to show safety and efficacy first. Well, it's not new news. It's been around for some time now. I mean, like every medication, there's always a potential benefit and risk. So we always hope, whether it's aspirin, whether it's over-the-counter medication, or whether it's diabetic medications in this example, certain medicines, diabetic pills and such, help definitely regulate glycemia. And for people who don't have proper sugar management, there's clear associations in multiple long-term trials of higher rates of acute coronary syndromes, heart attacks, and heart failure if not properly managed. There have been many trials that have basically suggested that as diabetes in one form or another ensues, whether it's impaired fasting glucose, whether it's pre-diabetes, overt diabetes, there's an association with increased BMIs, the body mass index, and waist circumference goes up. There's more adipose tissue. Adipose or fat tissue basically is a type of tissue that secretes many types of stress hormones that actually could lead to insulin resistance, among other factors that ultimately leads to higher sugar in the bloodstream and diabetes.